Litigation, court cases, tribunals, all scary stuff. So remember to protect yourself the best possible way with effective documentation. It can be quite difficult with short appointment times, busy hospital rounds, and the never-ending lure of just making a quick note. But effective documentation is really important in clinical medicine. It helps to maximize patient care, ensures confidentiality, and helps to protect you just in case the worst was to happen. Welcome back to our YouTube channel. My name is Camille and I am one of the co-founders of Pareto Education. We provide high-yield education to students and professionals. So make sure you follow us for more awesome content. So why does clinical documentation matter so much? Firstly, let's talk about it. Patient records serve several key purposes. Firstly, communication. In the modern NHS, they allow seamless communication across healthcare teams, ensuring that continuity of care. Legal record. Documentation can be evidence in legal scenarios, so it must accurately reflect the care provided. Quality and safety. Clear records help prevent errors and enhance patient safety. I mean, can you imagine treating a patient without access to their medical history? So dangerous. Basic principles of effective documentation. So let's have a look at some tips. Firstly, be accurate and objective. Document exactly what happened, what was observed, and what was done. Try not to be vague, such as patient seemed anxious. Instead, you could write something like patient exhibited signs of anxiety, such as pacing and shortness of breath. Timelines. Documentation is important because it helps to establish a timeline. Document as soon as possible after an event or interaction. This reduces the risk of error and ensures information is up to date. If you do have to document something late, always label it. What time the intervention was done, what time you saw the patient, and you can label this with documented in retrospect. Good quality documentation ensures confidentiality and security. You don't need to include unnecessary information and avoid recording non-clinical opinions or your personal judgments. Correct documentation should be without mistakes. If you do make a mistake, add in anything in error, never erase it, never write it out. Instead, you can cross this out with a single line, add the correct information and your initials and date it. Digital records often have an addendum or an amend function, which can allow you to ensure transparency. Use standardized terminology. Utilize appropriate medical terms which are widely used, such as ABCD, OBS for observations, etc. Avoid slang or non-standardized terms to ensure clarity between teams and everyone is working on the same page. Secure access with documentation. Always log out when leaving a workstation and never share your passwords. Remember, electronic hospital records track access, so be mindful of which entry you're making, which patient's records you are looking at. Every entry is stamped and time dated and traceable. This allows for accurate, secure entry and builds trust in our healthcare systems. Finally, remember, effective documentation is a skill that takes practice and attention to detail, but it is absolutely essential for providing quality care for our patients. By following these best practices, you're helping to improve patient outcomes and protect yourself legally and support your team. So there were a few tips from Pareto Education on documentation. Hopefully you can incorporate those in your clinical practice, and we'll see you on the next video.